Awesome. Well, it's 3, so I think we should go ahead and get started. We have a lot of material to cover today. Just quick FYI, we will be recording this, this webinar, this briefing. So if you don't want to be recorded, keep your video off. But otherwise, real quick, I want to say welcome to all of our panelists. And I'm really proud to introduce a leader on bold criminal justice reform and a champion of racial justice. Just proudly serving the 7th District of Massachusetts, Representative Ayanna Presley. Thank you so much for joining us today.
Thank you, Brenna. Thank you for that generous introduction, and thank you to everyone for joining us this afternoon. This is a critically important topic that sits at the intersection of 2 devastating crises in America. We're living through a crisis within a crisis, the public health crisis of systemic racism, police brutality, and white supremacy, and the public health crisis of COVID-19, both killing Black and brown people at disproportionate rates. At this moment in time, when righteous rage has driven thousands to the streets, demanding justice, accountability, and radical change, we must learn from the outcomes of racist policies that have created racist structures. We must listen to the activists and the experiences of those closest to the pain so that they can be closest to the power, driving and informing our policymaking. This includes Black and Indigenous people, transgender people, lesbian, gay, and bisexual people, people living with disabilities, people who are housing insecure, single parents, and people who have been traumatized by police violence. We must put forward bold solutions that decrease law enforcement interactions in our communities, and the time for that action is now. This is the reckoning. We are already seeing states and local governments across the country respond to the COVID-19 pandemic with an expansion of the police state, further leading to the criminalization of communities already disproportionately targeted for policing. We've seen the viral videos. Since the onset of social distancing orders, police officers have been shown distributing PPE to white residents, having a picnic on one side of town, while arresting and penalizing their Black neighbors just down the street. The involvement of law enforcement in addressing this pandemic is all too familiar for those who lived through the AIDS crisis. Experience shows us that surveillance, policing, and the criminalization of vulnerable populations leads to negative health outcomes and discrimination in healthcare. The COVID-19 pandemic has claimed the lives of more than 123,000 people in America. 123,000. This crisis has shed light on the broken systems that are failing to provide competent and affordable healthcare, protections from air pollution for our poorest communities, protections for vulnerable low-wage workers, and a livable, stable wage to pay the rising cost of rent and childcare. It is a pandemic that is in many ways unprecedented. However, there are many in the LGBTQ+ community who have lived through the AIDS crisis and for whom this all feels too familiar, what Wes Lowery refers to as a maddening deja vu. Those who watched their siblings and friends die in rapid succession while the government failed to respond. This community is feeling re-traumatized, and we owe it to them to do better. In my People's Justice Guarantee resolution to end the crisis of mass incarceration, I call for a radical reimagining, a bold new vision for justice, one that invests in shared power, health, freedom, and equality. One that decriminalizes survival and poverty and invests in whole people. In this moment, we are being tasked with radically reimagining systems deeply embedded with structural racism. Let us reimagine them as safe, humane, and supportive. From this pandemic, we need a just and equitable recovery. We need a path to liberation and healing. And just before I close, I do want to thank our panelists today, Andrea, Richie, Nina, Kana, and Michael Cox, again, for lending the expertise of your lived experience and your wisdom to this discussion. I'm grateful for your partnership and for your contributions to this work of anti-racist policymaking. Thank you.
Thank you. Thank you so much for that. Thanks. That was a great framing of, why we're here today to have this briefing. Real quick, my name is Brianna Diaz. My pronouns are she and her, and I am the policy director for the Positive Women's Network USA, or PWN. And PWN is a national membership body of women and people of transgender experience living with HIV and allies that exists to strengthen the strategic power of all women living with HIV in the US. We were founded in 2008 by 28 diverse women leaders living with HIV, and we develop a leadership pipeline and policy agenda that applies a racial justice and gender justice lens to the domestic HIV epidemic. I would like to start this briefing by, again, thanking Representative Ayanna Pressley and the LGBTQ Equality Caucus for hosting this important conversation on COVID-19 criminalization and its impact on marginalized communities. I also want to thank Whit Washington of the National Center for Transgender Equality and the Project for Trans Incarcerated Survivors for making this briefing happen and for your work on behalf of the trans community. So, before I dive into more of a question, answer, and conversation with our panelists today, I wanted to kind of frame a little bit about what's happening and why we're here. So in the United States, policing and criminal justice practices tend to reinforce societal inequity by targeting communities that are already marginalized and oppressed. As Representative Presley said, this targeting by law enforcement, the criminal justice system, impacts Black, Indigenous, and people of color, people living with HIV, LGBTQ people, no to low income people, sex workers, and so many more. And in light of COVID-19, federal, state, and local officials have called for new guidance in response to COVID-19, which has led to increasingly harsh enforcement of public health guidance. However, communities already heavily surveilled, policed, and criminalized will likely bear the brunt of COVID-19 related surveillance, policing, criminal charges, and penalty enhancements. A response rooted in policing and criminalization not only undermines public health and human rights, but jeopardizes the long-term survival of marginalized communities. It is critical that legislative and policy responses for COVID-19 be rooted in human rights, safety, health, and the well-being of our communities. So today our panelists will discuss COVID-19 criminalization, policing, and surveillance, how it has and will continue to negatively impact marginalized communities, and what we believe are solutions to the concerns addressed. And how these solutions can be enacted via federal legislation. So with that, I would love it if our panelists could introduce themselves with their name, pronouns, title, and organization, and how you got into this work. And I'd like to start with Nana Khanna.
Sure, thank you so much, Brianna, and thank you so much to Representative Pressley for her incredible leadership and commitment to the issues of police brutality, public health, racial injustice, and so much more. We're really grateful. I'm Nana Khanna, pronouns she, her, Executive Director of Positive Women's Network USA. We are a national organization, as Brianna said. I'm based in Oakland, California. And I come to this work as a woman living with HIV. I was diagnosed in 2002.
Thank you. Andrea.
Hi, I'm Andrea. I go by she, but I'm fine with any pronoun. I'm a researcher at the Interrupting Criminalization Initiative, a member of the Movement for Black Lives Policy Table, and a co-founder of the COVID-19 Policing Project, and come to this work through the lens of having worked on issues of policing and criminalization for over 2 decades, particularly through the lens of the experiences of women and LGBTQ people. And I just really want to echo deep appreciation and gratitude for Representative Pressley's vision laid out in the People's Justice Guarantee, which I think provides a really critical roadmap for us in this moment as we're trying to chart a way forward in response to the current uprising. Thanks so much for having me.
And Mike.
Hey, good afternoon, everyone. My name is Michael Cox. I'm the Director of Policy for the Boston chapter of Black and Pink. We're a nationally networked grassroots organization. We are an abolitionist organization. We believe in a world without prisons. And we use the experiences of LGBT people and people living with HIV as a vehicle into that discussion. I came to this work after being incarcerated for 6 years. I saw and experienced things nobody else should. And when I was released, I wanted to do something to create change. And so that brought me to Black and Pink. That brought me to be the administrator of the Massachusetts Bail Fund and the chair of the formerly incarcerated subgroup of the National LGBT and HIV Criminal Justice Working Group. Thank you.
Excellent. So clearly the right people to be talking about this issue. before I go into our questions, we will have time at the end of this briefing for question and answers that any attendees have. So we will allow, like, if you have any questions, you can pop them in the chat, and at the end, we will definitely revisit any questions. So yeah, I'll go ahead and get started. My first question is for Andrea. And I was wondering, how have policing and criminalization played out in the context of this COVID-19 pandemic, and what have the impacts been?
I think that, as Representative Presley pointed out, the policing that has taken place in the context of the current pandemic replicates and expands and extends the kinds of policing that is taking place in the pandemic of police violence. And so we've seen disparate enforcement in the ways that Rep. Presley described in New York, Chicago, Ohio, across the country, in terms of police harassment of individuals, arrests and ticketing and citations for compliance with public health orders that has almost exclusively in each of those locations targeted Black people, while white people have consistently violated and continue to violate public health orders. This enforcement of public health orders has decreased, but we're still seeing it happen in extremely violent ways. And certainly the example that many people witnessed of a young mother being taken to the ground in a subway station in front of her young child very violently, and actually more exposed to COVID-19 through the method of the enforcement, the close proximity of 5 police officers being shoved face down to a filthy floor, then, wearing a mask in whatever way she was wearing it or not could have put her at risk, or anyone around her. We've seen people being placed in chokeholds under officers' knees, similarly for alleged compliance or non-compliance with public health orders. We've also seen public health orders used as an excuse to approach people to then arrest them for other things like vagrancy or drug possession, or on my own block in New York City, having an open container. So the original approach was supposedly to educate people about a mask, but then, an open container became the excuse for the ticket. We've definitely seen targeting of gatherings, predominantly of Black and brown people, where large gatherings of white people happen routinely in parks across the country without any enforcement. And that is at least being used to threaten protesters with arrest. And most recently, Governor Cuomo made a statement that seemed to indicate that he was going to try and use public health orders to target protesters around mask wearing, when in fact the people who are not wearing masks at protests are police. Most police officers in New York City are not wearing masks at all, including during protest policing when they're extremely close to people and forcing people into close proximity and forcing people to be at higher risk of COVID-19 through the use of tear gas and other pepper spray that targets people's respiratory systems in the middle of a respiratory pandemic, as well as by kettling people into close proximity, putting them in buses where they can't socially distance for hours at a time, and then holding them in jail cells and deliberately keeping them there by not showing up to court dates longer than is permitted by state law, all of which increases the risk of COVID-19. What we wanted to point out, we are continuing to track enforcement of public health orders by law enforcement on the COVID-19 Policing Project website. It's covid19policing.com. And the fact is that there are still 51 jurisdictions in this country that require people to wear masks. There are still 72 jurisdictions that require people to keep 6 feet distance from other people when outside. And there are dozens that mandate quarantine upon diagnosis with COVID-19, so or exposure to someone with COVID-19, or symptoms of COVID-19, which are so many that the scratchy throat is likely, allergies could be a reason to force me to stay inside for 14 days under penalty of arrest and misdemeanor prosecution. And so we are carefully monitoring to see as many states move from blanket orders that apply to everyone to individualized orders that apply to people who test positive or have been to large events, say protests, or who are under quarantine orders, and also how particular communities, particularly the ones that have been most directly impacted, as Representative Presley pointed out, Black and brown communities, homeless communities, low-income communities might be the subject of containment as a community. So I'll stop there. What we're concerned about is contact tracing and the ways in which those methods are being used to potentially police and surveil protesters, but also the ways in which law enforcement is receiving in many jurisdictions data about people's diagnosis. And so we want to make sure that we create more privacy and more protections for folks around contact tracing, and I'll stop there.
Yeah, thank you so much for framing where we're at with COVID-19 criminalization. You know, the last bit that you just touched on about contact tracing, surveillance, and how that's ramping up and will likely continue to push this COVID-19 criminalization. Nana, I have a question. You know, there is a long history of medical surveillance under the pretext of protecting public health that has driven criminalization, policing, and punishment of stigmatized populations and health conditions instead of improvements in health. You know, failure to disclose one's HIV status can lead to criminal penalties in 29 states. And although the science exists to end the HIV epidemic, laws that criminalize behaviors and alleged behaviors by people living with HIV have presented huge barriers to achieving this goal. So what context can you share from the history of HIV criminalization that can inform our approach to thinking about the role of law enforcement in the COVID-19 pandemic?
Yeah, thanks so much for that great question, Brianna. And I think Andrea did set up the concerns really well. You know, the advantage that we have in this moment is that we have decades of knowing what doesn't work when it comes to HIV to inform us, and so that we can do better in addressing COVID-19. And so it's critically important to understand that there are strong similarities between who is disproportionately impacted by HIV in this country, who is disproportionately impacted by COVID-19, and who is disproportionately impacted by policing, right? So here in the US, Black and Latinx people, Indigenous folks, and other people of color are at increased and elevated risk of harm from all three of these pandemics. HIV, COVID-19, and at the hands of the state. And so this long history of criminalizing people based on HIV status, mostly Black, brown, queer, and trans folks, is exactly how we know that policing and criminalizing COVID-19 will actually not have the intended outcomes of preventing onward transmission or reducing the burden of the epidemic. And how we also know that these types of laws and practices will actually exacerbate harm in vulnerable communities, and in fact are already doing so, as Andrea laid out. And so here in the US, just as a little bit of context, laws criminalizing HIV are at the state level, not the federal level. There is substantial variation from state to state, similarly to how policing practices and criminalization penalties for COVID-19 are already playing out, right? So it's sort of a patchwork. And decades of evidence show us that HIV criminalization is actually exacerbating HIV stigma. It discourages folks from wanting to get tested for HIV, and it undermines public health strategies to reduce transmission in the community. We even have this slogan in the HIV community: take the test and risk arrest, because you can't be prosecuted if you don't know your HIV status, right? And so the way that COVID-19 criminalization is getting set up is very similar. It's an exact disincentive for folks to actually get screened and to know that they are COVID positive, to participate in efforts like contact tracing, because those could put them at risk potentially for criminal penalties, and other forms of violence that I think we'll probably talk a little bit about later. So this is a direct disincentive. You know, basically having these criminal penalties is a direct disincentive for communities to really participate in public health processes where we share the same goals. And so, you know, just as an example, even in a state like California, which folks generally think of as a very progressive state, a state where we have had, you know, on the records, sort of minimal criminal penalties for HIV, they were still found to be incredibly incredibly enforced along racial lines and gender lines, actually. So in California, according to a study that was done by the Williams Institute, Black people and Latinx folks make up 2/3 of the people who came into contact with the criminal justice system based on HIV status. Although Black and Latinx folks are just over half of people living with HIV in the state. Also women made up 43% of those who came into contact with the criminal justice system based on HIV status in California, although women are actually only 13% of the epidemic in the US. So you can see how these racial and gender disparities are playing out. We don't have data on trans and gender nonconforming folks because they are frequently misgendered throughout the criminal justice system. But we know that practices like walking while trans necessarily profile and police folks anyway. So all of these vulnerabilities compound so that we know that it is these, it is Black, Indigenous, people of color communities, queer and trans folks who are likely to bear the brunt of policing related to COVID-19 that we've already seen in New York and that we're likely to see play out all over the country. So these responses, like these types of public health responses, instead of being rooted in compassion, being rooted in surveillance, in police, are those that actually jeopardize the long-term survival of our communities. And I think I also want to say that, as somebody from communities that disproportionately suffer from poor health outcomes, we 100% share a desire to make sure that the response to COVID-19 is effective, right? That there's accurate information and that our people have the tools and resources and money that they need to be safe and to keep each other safe. So it's really important that we ground our response to COVID-19 in human rights and in protecting and prioritizing the safety, well-being, and health of marginalized communities. So this means public health responses that strengthen the safety net and that really uphold civil rights and human rights all throughout the process. I'll stop there, and I think we'll have more to talk about later. Thank you.
Thank you. And yes, we of course have more to talk about, but thank you so much for that framing. Michael, people who are incarcerated are at a greater risk of sickness and death as a result of the COVID-19 pandemic, and nationwide, the known infection rate of COVID-19 in jails and prisons is 2.5 times higher than the general population. So how has COVID-19 impacted both incarcerated and informally incarcerated LGBTQ people and people living with HIV? And how has it impacted people that are awaiting trial but have not been convicted of anything?
Yeah, thanks so much for that question. So for people who are awaiting trial, what we're seeing right now is that the courts are mostly closed or they've gone to digital methods. And we've seen many dates pushed back, which means that if somebody is held on a bail, usually at a state level, and they're not able to afford it, the end of their sentence is delayed and prolonged. And so they will end up spending more time incarcerated, even if ultimately their case will be dismissed. What else we're seeing is that organizations that run bail funds are not always able to safely operate as they were pre-COVID. So whereas in some places they served as a safety net and an escape valve, they're no longer able to play that role in the community. And so we see more people held on bail than previously. For people who are currently incarcerated and not able to make bail or already committed, we've seen some really scary stuff, particularly as it pertains to LGBT people. But before I go into that, I just want to state that LGBT people, people of color, Black people, trans people are all overly criminalized. So according to another study, we're about 3 times as criminalized as non-LGBT people. So the impact is severe on our community. And so the conditions that people face while they're incarcerated in general just always include communal living, recycled air, slow, and a lack of PPE. And so given that kind of context, we can see why there's a 2.5 concentration of people with COVID than in the community. So people just aren't given the tools that they need to protect themselves. Now, the correctional response to COVID in incarcerated settings has been botched and slow. So most facilities have seen their visitations canceled. They've seen programming canceled. There's been a lack of PPE, including masks and gloves. And then probably the most severe thing has been everyone's been put on lockdown status. And so that means that either folks are isolated to their blocks or they're isolated in their cells in solitary confinement-like conditions. And so people are losing their minds in these cells. They're not prepared to be dealing with it, and they're not offered opportunities to engage in wellness activities or anything like that that would maybe offset some of those side effects from isolation. And those side effects from isolation are increased suicidality, both attempted suicide attempts and completed suicide attempts. And we know that the LGBT community, particularly trans folks, are already at increased risk of this phenomenon. And then adding incarceration, adding this increased isolation just magnifies and compounds that. In other settings, as folks have already kind of alluded to, there's a disincentive to be tested. So when you are tested, in some facilities, they're automatically isolating you in solitary confinement. So who wants to be tested when you're going to be placed in solitary, which has been defined as torture by the UN for anything over 15 days. And then for those who are testing positive, they are being ripped out of their cells. They are being isolated. And for transgender people, we're hearing across the nation that when this move happens, they're often being celled with cis men, which is often not safe for them. And they're at increased risk of sexual violence. Also, people living with HIV, there's approximately 4 to 9 times concentration of people living with HIV in custodial settings. The reports we're hearing at Black and Pink are they're scared to death. They're scared that they already don't get the medical care they need, and they're so afraid that if they do get COVID, you know, their chances of surviving it are very small. And then for those being released from custody right now, there's been a freeze on a lot of reentry homes, including sober homes programs and even shelters. There's restricted movement into those facilities. And so those being currently released don't have as many options as they used to. In addition to that, we see that people are not able to get their jobs that they need to restart their lives. So again, they're coming out with no resources, in worse condition than pre-COVID days. And so I think maybe I'll just leave it there, and I'm sure there'll be time for more. Thanks.
So what I'm hearing is, you know, we're creating new orders and new laws, reinforcing existing laws in problematic ways to criminalize people based on a virus, and then putting them in detention centers, prisons, jails, where their health is like further attacked, right? So it's almost like we're perpetuating this cycle of like criminalization, violence, and policing and surveillance. That is a horrible problem to have right now. But yes, addressing COVID-19 and criminalization is quite a task for each one of us that are trying to work on this issue. But we have thought of ways that, you know, the federal government can address these issues that we've identified. And so I'd like to ask our panelists now for, you know, some solutions that they had in mind. So Andrea, you know, I guess I'm thinking like, where do we want to be? Like, where do we want to go to achieve our solution? So my question for you is, how do we need to limit the role and harms of police and policing in the context of the pandemic? So for example, given that immigrant populations, whether documented or not, are already often fearful of accessing the healthcare system, how do we ensure that, one, no information on a person's immigration status is collected, or two, if it is collected, how can we guarantee that it will not be shared with law enforcement agencies, including DHS or ICE? Uh-oh. Well, we can get back to that question if Andrea can rejoin us. If not, I know someone else can answer it. But Michael, I'm going to go ahead and go to you. What steps do you think Congress should be considering to reduce the debilitating impact of COVID-19 on incarcerated people and those being released during the pandemic?
Yeah, that's a great question. It's something that we've been really focused on at Black and Pink. So the main thing that we could be doing right now is to be reducing the population of incarcerated people. We know that this kind of communal settings are just a breeding pit for COVID-19. And so by decreasing the population, we decrease the amount of people in close proximity to one another and being able to give more space to protect themselves from COVID. I think that along those lines, we need to be prioritizing those who are most susceptible to COVID-19, including our elders. The prison population is just exploding with elders. Some of these facilities look like geriatric units. We need to be prioritizing those with underlying medical conditions, including HIV, including diabetes, asthma, and other conditions that would almost spell a death sentence for an incarcerated person. The other thing is that in a lot of facilities, they will charge you to access medical care. And so if that is happening in facilities, Congress should be stepping in to make sure that either those copays are paid elsewhere, or they should not be assessed at all. And they should also be addressing that, excuse me, that people are being placed in isolation and solitary confinement. And instead of that, Congress should be making sure that there are facilities and capacity to let people safely house and quarantine that do not include 23 hours of isolation. PPE should be included in any kind of funding package that Congress may offer for incarcerated people and those being released from custody. That's one of the basics that we all know, we've all learned, but unfortunately incarcerated people aren't able to pop out to the store like we are or order something on Amazon. And some of that PPE should definitely include sanitizers, soap, cleaning materials, masks, gloves, all the basics that we know out here, and incarcerated people are just as much entitled to that level of dignity and respect as we are. So we should be making sure that they get that. And then as far as folks being released at this time, we need to make sure that there are resources for our communities, particularly brown, Black communities, trans communities, and the LGBT community, so that they can safely house when they are released from custody. We know that people who are housed fare so much better than not being housed. We know that the capacity and the social safety net is so strained right now in facilities. We should be making alternatives and expanding the options for our people if we really believe in a safe, beautiful community. Thank you.
Thank you so much for those concrete solutions, Mike. Those were perfect. Andrea, I'm going to kick it back to you. I'm going to rephrase the question, but how do we need to limit the role and harms of police and policing in the context of the COVID-19 pandemic? For example, given that immigrant populations, whether documented or not, are already often fearful of accessing the healthcare system, how do we ensure that no information on a person's immigration status is collected, or if it is collected, guarantee that it will not be shared with law enforcement agencies, including DHS or ICE?
Yes, and I apologize for my internet connectivity issues. I feel like I'm a poster child for the need for universal broadband in this moment. What I wanted to say is that we need to do everything in our power to uncouple law enforcement from anything to do with the response to the pandemic, whether it's decriminalizing transmission completely, uncoupling public health order or guidance or quarantine from criminal justice enforcement, and that is in any form, whether it's the police or a public health officer. No one should be arresting you in connection with public health issues, and particularly given one should be in a situation of greater risk. And that means, in a specific question that you asked, Brianna, the contracts that the government has into corporations, data across public health puts not only and gender non-conforming people of being targeted by vision of law enforcement access to people's test results eradicated in the next to be rescinded.
All right, so sorry about that, y'all. Internet is also something that, yes, Andrea said, needs to be funded. But when she comes back, we'll hear her answers. So for right now, I'm gonna go ahead and ask Nana hers. So Nana, you know, the CARES Act allocated $631 million to expand surveillance testing and contact tracing. We've heard a little bit about contact tracing already, but I don't feel like we know enough about it yet and why it needs $631 million. And the HEROES Act that recently passed the House allocated another $75 billion to testing and contact tracing. So what are some learnings and best practices from the 4-decade-plus HIV response that could help inform our COVID-19 response?
Thanks so much, Brianna. So, you know, one thing that I just want to say before I talk about contact tracing is that there's a ton of political will to correct this problem of HIV criminalization. You know, even in the 2 versions of the National HIV/AIDS Strategy released by President Obama in 2010 and 2015, both of those called for repealing these HIV criminalization laws, and we have been making progress on that. But these laws have to be undone state by state. And so they have been, you know, reformed or repealed in probably about 3 to 5 states over the last few years. And I share that a little bit as a cautionary tale because we don't have to have this problem with COVID-19 if we do things right now, right? So help us make sure this doesn't happen again. So contact tracing is something that has been a pillar of HIV and STI surveillance for a long time. And it's basically predicated in part on, you know, going and finding, asking people, asking like, you know, in the case of HIV and STI, sexual partners or potential needle sharing partners, asking folks who they might have come into contact with who could be at risk. Now, again, there's lots of data from the HIV response that shows us that when people know they are living with HIV, they take steps already to really reduce exposing anyone else to HIV. And I think that we can apply those same lessons to COVID-19. And like part of the issue here is that we need to trust folks. We need to trust people. People do actually want an effective response to COVID-19. People do not want to endanger themselves or their families or their loved ones or their communities. Because of the disparities that we're seeing in the epidemic, you know, sometimes people don't have the privilege to take the steps that would be needed to protect their communities and others. And so, but law enforcement really does not need to play a role here. So contact tracing is a really sensitive activity. Who does it and how it gets done really matters. And it really matters in light of not perpetuating existing inequities and also perpetuating potential violence. So people can be at risk for violence if it is just in a situation of intimate partner violence or community violence, if it becomes known that they are living with COVID-19 or living with HIV, they can become targets of violence. And so it's really important that we do this type of contact tracing carefully. The biggest asset of public health in this moment in responding to COVID-19 is the trust of the public, including the trust of the communities bearing a disproportionate burden of the epidemic. And so workers who do contact tracing are usually called disease intervention specialists, DIS workers. And they need good, solid training to build positive relationships with the communities. Ideally, they come from the communities that they are reaching out to so that they understand, you know, cultural nuances, issues around confidentiality, issues around stigma and judgment, issues around data privacy and protection. Like Brianna was referring to, that it's really important that folks don't have the perception, whether it's actual or not, that their information could be shared with law enforcement, with immigration enforcement, et cetera. There has to be trust established, and we can't minimize the impact of medical mistrust in setting up these systems around COVID-19 criminalization. We need to remove barriers to people being able to take care of themselves and others. So also in terms of thinking about contact tracing and this infusion of resources, you know, there's sort of like a surge capacity being planned for right now, but this rush needs to make sure that we don't sacrifice being very prepared and training folks to be prepared with cultural humility, understanding and minimizing their own biases, understanding the risks and the harms of the work that they're doing, and education on trauma-informed principles for engaging with the public. We need to be hiring from most impacted communities and partnering with community-based organizations that are already embedded in those communities to provide these types of services. And we need to make sure that we never think about civil rights and human rights as something that is in contradiction to public health. Actually, public health gets upheld when we rest on a foundation of upholding civil rights and human rights. And so understanding that, you know, that Black people in particular in this country are bearing the burden of COVID-19, of criminalization, of racialized policing, and that we need to make sure that we are putting all kinds of protections in place to ensure that contact tracing is done in the most sensitive way possible.
Thank you for that great explainer on contact tracing and how we can, you know, directly address these looming concerns with it. I believe we have Andrea back on the phone. Andrea, if you would like to continue answering your question, the floor is yours.
Thank you so much, and I'm quite certain that both between my fellow panelists and you that you've said everything I would say, so I apologize for both technical difficulties and repetition, but the basic gist of the recommendations are to really uncouple everything to do with public health orders and COVID-19 from the criminal punishment system. So that means, of course, decriminalizing transmission. Some of the arrests that we've seen through our tracking in recent weeks have not been so much about enforcement of public health orders as it's been about arresting people for alleged or attempted transmission, and particularly in the way that HIV has been criminalized through alleged assault on police officers by people that officers claim spit on them or did other things that are unlikely to produce transmission but carry high charges. And then also to make sure that law enforcement aren't getting access to people's test results. In many jurisdictions, over 30 at last count, people who test positive, their name and address is shared with law enforcement and other first responders, which obviously creates more opportunities for policing and surveillance of people testing positive and the deterrent effects for testing that Nana was talking about earlier. And that we need to end federal contracts, one alone in the amount of $24 million of the $500 million that Health and Human Services was given for contact tracing has gone to Palantir to integrate data across all levels and platform of government with public health data. So the question of someone's immigration status now being linked with their COVID test result and therefore potentially resulting not only in public health policing, but now immigration policing and other forms of criminalization is a risk that needs to be pulled back. That contract needs to be canceled. The work of data integration with public health information needs to be undone. And none of the federal money that's being dispersed under any of these stimulus packages or legislative packages should go to law enforcement or private entities acting in the interest of law enforcement that in ways that criminalize COVID diagnosis, transmission, and compliance with public health orders. And I think that the piece that I just heard Nana say around supporting folks
It's easiest for those of us who can work from home, who can have access to all the things that we need over the internet or through delivery or in our own homes, to stay home and to stay safe and to be in compliance with public health orders, including if we test positive and are required to quarantine. But when people don't have income support, when they don't have employment protection, when they don't have safe housing, when they don't have housing at all, it's very difficult to comply with those orders, and that exposes people to criminalization. And so we need contact tracing and quarantine efforts to come with support. Someone should call and say, I'm sorry to tell you, Andrea, you've tested positive for COVID-19. Are you scared? You know, is there any questions that you have? What can I do to reassure you first? Secondly, is there anything that you need right now in order to stay safe and quarantine safely? Are you concerned that if I tell anyone that you live with or that you've come in contact with, that they will take out on you in some way that jeopardizes your safety, the fact that they now also have to quarantine? Is there anything we can do to help you be safer in that situation, from your partner, your abuser, your neighbor, your employer? What can we do to help you quarantine safely at home and the people around you safely at home? Are there emotional supports you need? As Mike was talking about, it's very difficult to be in solitary, certainly inside a prison, but it's also difficult to stay and not ever leave your house for 14 days, particularly if you have other conditions, physical conditions or mental conditions or conditions of the place that you live that make that even more difficult. And so, you know, how can we help you? Do you need a caseworker to stop by every day? Do you need someone to sing outside your window every afternoon? Like, what can we do to make it easier for you to do the things that are important for your health and your community? That should be the approach of contact tracing, not I'm calling to tell you something, I'm not offering you any support, I'm demanding information from you, I'm not telling you or giving you any guarantees of protection or privacy, I'm not supporting you around the fact that as soon as your abuser finds out that he has to quarantine because you got sick, you're going to have hell to pay, and I'm certainly not going to provide you a safe place to do that. I'm going to make you pay for it, and you might lose your job, and you might lose every other thing that requires you to go outside. And so I feel like if we're thinking about the stimulus package, we should think about how we would want to be treated if we tested positive for COVID, or how we want anyone we love to be treated, and build a stimulus package around that. And that means taking money from law enforcement and putting it to the things people need to survive what I would call a triple pandemic. You know, Representative Presley talked about a double pandemic, which is COVID-19 and police violence and criminalization. The triple pandemic is the unprecedented economic crisis that we're living in right now, with 40 million people unemployed and much more hurt to come. Eviction courts are starting to open up across the country. We're about to experience waves of homelessness, of unemployment, and of criminalization of all the things people do to survive under those circumstances. And so I would just really urge that the next stimulus package have enough for people to live on and survive, not just for a month or a week, but for months, and that come repeatedly, and that it not be means tested, and that we move money from criminalization to public health and to the things people need in order to survive this triple pandemic.
Thank you so much for those concrete asks. You know, I want to reiterate before we move to question and answer some of the asks that we made today that can be included in a fourth or fifth stimulus package. And some of those asks include explicitly prohibiting the sharing of an individual's health data with law enforcement, requiring that all legislation responding to the pandemic must include an explicit prohibition on the use of federal funds for law enforcement to criminalize actual or perceived violations of public health orders around COVID-19, and that federal relief packages must invest in testing, treatment, care, and as Andrea just articulated, community support, not criminalization. We also want to be wary of awards of federal funding to states and local governments that should prohibit the adoption and enforcement of laws criminalizing the potential for or actual transmission of COVID-19. And while that last one might sound a little random, we've actually already seen such legislation introduced in New York State that would criminalize not the actual transmission of COVID-19, but the act of attempting to. And this kind of sentiment will likely spread across state legislatures. And so we want to ensure that any relief funding that is given to states in their treatment and testing federal funds, that criminalization is never an option. And so with that, I would love to open it up to question and answer. So again, if you have any questions, attendees, you can drop them in the chat. We also have a question and answer feature on Zoom. But I'm gonna go ahead and start with one question we received from Sean. This question is for everybody, but I would like to start with Mike. And the question is, Mike, are there any states or jurisdictions that are doing a good job on decarceration, or at least better than others?
Yeah, for sure, some are better than others. But what we've seen across the nation in the different states is almost every state took a different approach. And so I think that we can just take a bird's eye view and look at what tools different states used. So here in Massachusetts, through the Supreme Judicial Court, they issued orders for everyone held pretrial to basically get a second bail review with very specific guidelines that gave people presumptive relief, and that it was challengeable by a DA, but basically presumptively you would get a $0 bail. How that was operationalized was a little botched. We didn't see everybody released on pretrial, but we did see a decrease in people held in pretrial detention. And so I think that's a great tool to use, decreasing the number of people held in pretrial custody. Also here in Massachusetts, we saw the first district federal judge, he had released a bunch of people from ICE detention under the same grounds. And he really quite strongly said, there's no reason these people shouldn't be out in the community already. If they were held in criminal court, they would have been released on no bail. And so I don't see, he didn't understand why they had to be held under civil laws. So I think that that's another great thing that we could be applying to folks held in ICE detention. Other states have released people that were basically short. So within 100 days, 180 days of the release date, they were being released early. I think that's a great low-hanging fruit way to go. We've also seen parole increase in some areas, not in Massachusetts, but for example, in Michigan, we've seen parole increase by over 1,000 people each month. And so I think that drawing from all of those tools, we could actually come up with a really concrete plan on how to decarcerate our prisons and jails so that our communities can truly be safe. I would just say that although some of these plans look great, in operation, they didn't all work out the way they were supposed to. So somebody crafted a really beautiful, good plan, and then the people that were executing it and operationalizing it just didn't do it right, and they didn't give as much relief as they could be. And I would just mention that one other tool that states, some states have used, but they could be doing more of, is medical parole. So folks that are very immunocompromised or have serious medical conditions, they could be released to the community. And then I would also just close this off by cautioning folks to not be distinguishing between violent and nonviolent offenses. You know, I was someone convicted of a violent offense. I'm somebody living with HIV. And so under all the rubrics that would have been created for relief, I would have been left dead in a cold prison cell. And so I would ask people to really, really consider that strongly before they implement a policy like that. Thanks.
Thank you for that answer, Mike. Would any of the other panelists like to respond to that question? Because I got more questions then.
I mean, I think that there's no state that's doing policing right. Say right now, I think that's why we're having a national uprising around it. But I do think that, you know, Representative Presley's People's Justice Guarantee really offers a blueprint for states that want to reduce criminalization across the board and want to invest in the things that communities need to survive the pandemic of police violence, of COVID-19, and the economic crisis. And so there's, you know, any state that wants to adopt legislation consistent with the People's Justice Guarantee would, I think, be making important strides towards addressing all three.
Thank you. So I have another question. And this is open to anyone, but have there been any states that have set an example with their use of law enforcement in correlation to COVID-19 that can be used as a tool to help guide other states in a more appropriate direction?
I think that was the question I was just answering. So
there we go.
Ahead of that game. Thanks.
Yeah, I definitely can add to that. An answer to that too is, yes, and there's currently a bill in New York State that would bar law enforcement from accessing contact tracing data. It is the Contact Tracing Confidentiality Act, and it is Assembly Bill 10500-A, introduced by Rep. Godfrey. That is the first I've ever seen a state introduce to take action into their own hands and prohibit law enforcement and immigration enforcement. But yes, that is one concrete COVID-19 example in addition to what Andrea said. But yeah, do we have any other questions from our attendees? Okay. Then with that, I would love to give our panelists about 1 to 2 minutes each for any final thoughts you all have. Oh, wait, no, we have a question. Cool, so I will ask this. Thank you, Ellie. Panelists, how would you suggest we center BIPOC people, incarcerated people, trans and GNC and LGBT people, and people who are HIV positive in employment law and policy right now? There are some intrusive employer policies we're hearing about that parallel some of the problematic law enforcement practices. What else? That's a big question.
I'd like to respond to just a piece of that, if that's okay. So I know that in some of the relief packages, funding for formerly incarcerated people or those with a criminal record were excluded from employment benefits. And so I think that that's a place that we could start, at least by not excluding formerly incarcerated people with convictions from that kind of relief. They are more likely to be hiring other formerly incarcerated people, those living with HIV, trans, BIPOC folks. And so I think that's really low-hanging fruit, and we should be removing that barrier to relief.
If I could jump in, I think similarly we should prohibit COVID testing as a condition of employment, which I'm hearing people being told formally or informally that they need to have a COVID test to come back to work, which, we all know that a COVID test could be negative one day and not the next. And so it's creating opportunity, increased hardship for workers. And I think employment protection, should someone test positive for COVID, some states do have that in the context of, your job shall be preserved for the period of time that you're required to quarantine, but most states don't. And that should definitely be something that is included in federal legislation if possible, or as a condition of receiving federal grant money, as well as income support while quarantined. I mean, in some states, again, that is provided by law. Unfortunately, in those states, it's the same as you get paid for jury duty, which is $2 a day or whatever. So, income support while you're quarantined, that's actually the equivalent of living wage for the jurisdiction that you're in, would be better. But some sort of non-discrimination in employment provision. And obviously, if you do test positive for COVID and you work in an industry that requires you to come into contact with the public, then yes, I mean, you should be able to quarantine for the appropriate length of time and keep your job and keep the income support, but it shouldn't be sort of used as a deterrent for people testing by having adverse employment consequences.
And I would just also add, I think this is a very huge question that I'd love to talk about further, because there are lots of problematic employer policies, and with the kind of variation in how states and localities are reopening, people are being placed in different situations with respect to their employment. And so the other piece I would add is that, when offices or workplaces are reopening and folks are being asked to come back to work, there needs to be a way for people living with other chronic health conditions to not have to disclose that information, but to be able to opt out. And and ask for different kinds of support, like remote work support and things like that, or and to access the types of protections that Andrea was just talking about. So, and that's a particularly concern to people living with HIV and other chronic health conditions.
I'm sorry, just to tack one last thing on that. I think a lot of employers are now sort of thinking about temperature checks as a method of also regulating people's return to work, and some are already implementing that. And, there can be a lot of reasons for having a high temperature, and some of them come with chronic conditions that people have, and people shouldn't be required to disclose chronic conditions or disabilities in order to explain why they have a temperature every day, but they don't believe that that's a reason they should be excluded from the workplace under suspicion that they have COVID. So we have to come with some more accurate, to the extent that screening is required or enabled, more accurate screening procedures, because there are some that discriminate kind of by definition against people with certain health conditions or disabilities, or that would force disclosure in ways that shouldn't be forced.
Excellent. Thank you so much for this incredible conversation today, Nana, Mike, and Andrea. I hope we shared a lot of information, approachable information with attendees. We will follow up with resources and our contact info. We'd love to connect with staffers who have attended this to work on these federal solutions that we've offered. But with that, I want to give you all a quick sign off, and then we'll be on our way. So thank you again, panelists. Thanks, everyone.
Thanks, everyone.
Thank you so much.
Thank you.